I'm here with Dr. Pfeiffer and Dr. Whitfield, and we're going to talk about what is available now to really help people recover faster from surgery. Any particular medicines that you like to use that would help people recover? Is there anything that you all use?
I use Exparel on every breast case as an outpatient. I use it inpatient, outpatient. I think it's, to me, the most valuable thing that I've added from an operating room perspective, and they wake up pretty comfortable, and they don't require as much narcotic, they don't have problems with grogginess, being tired, constipation, which is always a battle after taking narcotics. So I think that's been a huge benefit for me.
You know what I love? I love to use muscle relaxers. So I use methylcarbamol, and I use it for all my breast cases and all my tummy tucks. So I have the patient take 2 pills the morning of surgery, and some anesthesiologists will give it IV, 1,000 milligrams, but I like them to take 2 pills the morning of surgery, and then it's in their bloodstream. So by the time they're having surgery, the muscle is really relaxed, because especially with tummy tuck or subpectoral breast augmentation, the muscle is going to go into spasm, and that's what gives a lot of the discomfort after surgery. So you're really cutting it off at the pass and preventing it from even happening.
So then after surgery, what are the tricks to really get people back?
Well, I think the thing for patients to understand is that, recovery is a process, and the first 3 days, really, you're in an intense phase of healing. So you can't do too much those first 3 days, but I continue the muscle relaxers. So if you pre-medicate and then stay on a routine medication schedule, which we go over with the patients, you're going to be good going forward, and you can keep your pain level on about a 2 out of a scale of 1 to 10.
You have to be smart with each patient and manage, what do they do in their lifestyle? If they're somebody who's vigorous exercise regimen every day, then you have to control that, because they're going to create a problem for themselves. They may not even feel that they've had a significant amount of surgery with Exparel and the muscle relaxants and a mild amount of narcotic, and you transition them to anti-inflammatories and Tylenol pretty quickly, but you have to manage their vigorous exercise regimens or their activities or their workload early, because people will push themselves too hard right after surgery.
And that's the other issue too, is that a lot of times after surgery, one of the main things that everybody's focused on, including the patient, is to decrease, you want the swelling to be decreased. And if you engage in a lot of exercise, your blood pressure goes up, your circulation is increasing, and you're going to have more swelling after you exercise at that level. So then it's going to take longer for the swelling to go down.
So there you have it. There's a lot of different things that can be done, a lot of do's and don'ts, and there's some good information there, so thank you.